Welcome and thank you for dropping by our virtual open house. I am Dr. Frances Keach, the Dean of the School of Medical Imaging and Therapeutics at MCPHS University. And I have a few colleagues here with me today to help introduce you to the programs we offer in our school. We all have a passion for our professions and cannot wait to tell you about them and your future in one of our degrees. Our programs are unique. They are accelerated. That means that you complete a bachelor's degree in 3 years. And if you have transfer credit, you can reduce your time down to 1 or 2 years, depending on the program. Starting as a freshman in one of our accelerated programs means you graduate a full year in some cases before your current classmates in high school who start the traditional bachelor's program at a regular university or liberal arts college. We offer programs of study in magnetic resonance imaging, diagnostic medical sonography, general and echo, and nuclear medicine technology, radiation therapy, and radiography. As I mentioned, these are accelerated programs. And they offer for our students an integration of instruction which includes liberal arts, basic and applied science, social sciences, professional coursework, and clinical education, all integrated together to give you a bachelor's degree in the shortest time possible. The students who thrive in medical imaging and therapeutics are students who love math and science, computers and problem solving, active and team-oriented work environments, working with patients at all stages of illness, camaraderie and small communities, and people who love innovation. These professions are changing daily, and keeping up with them requires somebody to really enjoy what they're doing and really sort of work to understand what's going on. I'd now like to introduce my colleague, Jennifer Miller, who is the Program Director for Diagnostic Medical Sonography.
Hello, everybody, and thank you for considering MCPHS University for your higher education. So Diagnostic Medical Sonography has 2 tracks. I am the Program Director for the general track only. So it's basically everything except the heart. Our program is accredited in abdominal and OBGYN. We also offer some classes in pediatrics, MSK or musculoskeletal, breast, and vascular. So we offer a very well-rounded program here. What sets us apart from the other programs in our area is we have a bachelor's degree, and also the amount of lab time that we have. We teach our students the protocol so that when they go out to clinical in their last year of our program, they are able to complete normal exams. And that kind of puts them ahead of the game with the other programs in that they can spend more time really concentrating on learning pathology and not so much worrying about how to actually do an exam. We're really proud of that. In order to become a diagnostic medical sonographer, you must pass 2 board exams, national board exams. One of them is in physics, which tends to scare people, but it's not that bad. And one is in a specialty exam. So our physics, our first year, we take 2 semesters of physics, and during the summer, we take a review class. All of our students take their physics exam that first summer, and that class is designed to help them along in that process. Then they move on, they go to clinical, and because we are accredited, our students are able to sit for their specialty exam 60 days before graduation. So a lot of our students will actually graduate with their board exams completed and their bachelor's degree, ready to get a job and ready to get right into the workforce. What also sets us apart, we have excellent clinical sites. Being in the Northeast, we have amazing sites for our students all over New England, from Vermont to Maine, and all over Massachusetts. So with that, I would like to let you meet Professor Dolt, who his passion is the heart.
Thank you, Professor Miller. Hello. I am Brian Dolt. I'm the program director for echocardiography. As Professor Miller mentioned, general ultrasound looks at the entire body, and echocardiography specializes in the heart. So it is cardiac ultrasound. And this is an image of my first love, the parasternal lung axis. And when people think about heart disease is still the #1 killer. And when they think about heart disease, we often think about heart attacks. But echocardiography can also look at the heart muscle and how the heart muscle squeezes, but also look at valvular disease. And valves in the heart are going to open and close, and we can look at how well the valves open. We can look for stenosis if a valve doesn't open correctly, and also if a valve doesn't close correctly, it may have regurgitation. So as Professor Miller mentioned, both general and cardiac ultrasound have extensive lab time. We focus on scanning our classmates, being proficient at doing a normal resting echo, so that when we go to clinical, we try to set our students up for success, and that they're able to impress the clinical site by actually being able to perform a full resting normal echo. And then while you're at clinical, you can focus on perfecting your technique of scanning and learning more about pathology and other types of heart disease. Clinical sites, we have clinical sites throughout all of New England, some of the best clinical sites in the entire country. Also, I just want to mention about our faculty. Our faculty have also been working in Boston, all of the best echo labs in the country. And our faculty is devoted to ultrasound. It's not just a career for us. Every one of the faculties, Professor Ficacello, Professor Hill, and myself, it's not just a career or a job, but we all have a passion for cardiac ultrasound. And even when we're not at work, we will call each other and talk about cardiac ultrasound and echocardiography, because that's just what we love. And the big thing is that we show that enthusiasm and excitement every day, whether it's in the classroom or in lab. And we hope that that becomes infectious, and our students also love the field of echocardiography. So thank you very much, and thank you for considering echocardiography. And I would like to send it back to Dean Keach.
Thank you very much, Brian. I'm going to actually talk to you about magnetic resonance imaging. And we have a program here that is 18 months. It starts in the spring semester of the second year. It's a full-time program. MRI studies play a significant role in the detection and the diagnosis of numerous diseases in organs and systems of the body, as well as soft tissue and musculoskeletal. I'm sure you've all heard about the MRIs that athletes have coming off the field with an injury. They are as important and necessary now as most just general diagnostic x-rays. The MRI technologist works with an imaging team to prepare patients for scanning procedures, use system software for image production, and review images and processes. The images you see on the screen currently are images, of course, of the brain, and can be taken in any sort of direction, in any sort of means, and can also be done with contrast, taking a look at all different types of diseases and also issues to do with the brain, spine, and, as we mentioned, musculoskeletal. The magnetic resonance imaging program has been around for about 10 years, and it's an incredibly successful program with clinical sites all over New England, and especially around the Boston and Longwood medical area. The students get to have an experience in the clinical setting that prepares them well for all the different types of imaging with magnetic resonance. They also are able to and have gotten jobs. Our placement rate is about 100% at the moment. They are in short supply, and everybody is looking for MRI technologists. one of the things that we really sort of enjoy about MRI at the moment, and are really pleased to inform people, we now have simulation equipment in the school so that students can actually simulate setting up patients on the beds with coils. We, of course, don't have the big magnets, but we do have the equipment. And we also have simulation software, which allows them to mimic acquisition as well as processing of images. I would like now to introduce a colleague, Dr. David Gilmore, to talk about nuclear medicine.
Well, hello, everyone, and thank you. Nuclear medicine technology may be something that you have or have not heard of in the past. And we're a true subspecialty of most of the radiology and cardiology departments, in which what we do is look at the physiology of a particular organ and a particular disease. Now, our program does work a little bit different than some of the other medical imaging and therapeutic programs here at MCPHS University. You're going to spend the first 2 years working and taking prerequisite courses. And these courses include things such as biology and microbiology, because we really need to understand the cellular level and really what's happening once we go to inject radiopharmaceuticals into the patient, to kind of study really where is that disease, what do we see at the molecular and cellular level, and what do we need to do to treat those patients. Now, we both diagnose patients, but we also treat patients as well. So we kind of live in both of the imaging and therapeutics world with it. Why is our program really unique here? And part of that is because, very similar to DMS, we do have clinical sites throughout all of New England and most of the states, but also outside of New England. And that allows you to, one, when you enter that professional year, which is between year 2 and year 3 in that summer, to maybe live closer to home if you do not wish to continue to live in the Boston area, or to be able to see both the Boston area as well as areas outside of Boston and get that clinical experience. Our students do rotate through all of the major medical academic centers here in Boston, but again, as I said, at other places as well. One of the things that continues to make us different and unique is that we are an accredited program, and that allows our students to take all of the certification exams that are available in nuclear medicine, as well as CT or computed tomography. As the technology continues to change in many of our fields, we also want to make sure that we're preparing our students not only for nuclear medicine, but for CT as well. And so you will have that option to do that. Similar to some of the other programs, we have had in the past year some great success, not only are all of our students getting jobs when they graduate, but they're also passing the boards on the first try as soon as they finish with the program. So with that, I'd like to turn it over and let's hear more about radiography.
Thank you, David. Hello, everyone. My name is Ryan Pachinin, and I'm the clinical coordinator of the radiography program here at MCPHS. Radiography uses ionizing radiation to provide diagnostic images to radiologists. I kind of jokingly say we're the first line of defense because we're very cost efficient and economic and speedy with our diagnoses. Usually somebody comes into the hospital because they injure themselves. The first thing that is usually ordered is an x-ray. Within the hospital, we get to travel throughout the whole hospital. We get to go to the OR. We get to go to patient rooms. We travel using our portable machines. So it's an interesting experience in the sense that you're not necessarily going to be in a department all day long. You actually get to travel throughout the hospital and see the different parts of it. With that said, we also deal with a variety of patients. We deal with infants all the way up to geriatric patients. The employment opportunities when graduating from the program are those mostly sought out at the clinical sites in which the students have attended. This is chosen to be a pretty successful path. The sites that we share are ones within the Longwood medical area, as well as the greater Boston area. We also have some specialty hospitals that deal strictly with orthopedics, as well as another specialty hospital that deals strictly with pediatric patients. The curriculum is based on didactic work, as well as hands-on experience with our radiography lab, in addition to clinical experience. We've had a lot of success recently with the job market, and our students have achieved 100% job placement rate as of recent. Now I'd like to pass on to my colleague, Kelly Ebert, to speak about radiation therapy.
Thanks, Ryan. And last but not least is radiation therapy. And we're kind of last in this presentation by design. Radiation therapy is different from the other modalities that you've heard about in that we are nearly always just therapeutic. We don't ever take an attempt to diagnose any disease. We use ionizing radiation to treat disease. And in about 99% of the cases, that disease is cancer. Another thing that really sets us apart from other imaging modalities is that in radiation therapy, you really get the opportunity to get to know your patients. We typically treat our patients every day for as long as maybe 8 weeks. So you get to use the your people skills and the emotional part of your personality in radiation therapy. I also like to say that radiation therapy uses both sides of your brain. It allows you to really critically think and problem solve, along with using kind of like the warm and fuzzy communication skills that hopefully you have that draw you to radiation therapy. Much like the other professors that you've heard from, the radiation therapy program is structured with lots of classroom experience along with clinical experience. Our clinical sites are throughout the state of Massachusetts, all over the state, and we have a couple clinical sites in the Rhode Island, Providence area. So the clinical rotations begin the last 3 semesters of the program, and they're nearly full-time. So you'll have lots of hands-on opportunity to experience being a radiation therapist so that by the time you graduate, you are nearly trained on the job. So you're ready to go. And we see direct results from that in that we have in the last several years 100% job placement rate. Most of our students are able to find jobs during the last semester of the program as they're rotating in our clinical sites. Often our clinical sites come to us and say, you know, who do you have available? Who's looking for a position? So we're really proud of that 100% job placement rate. So good luck with your decision.
Thank you so much, Kelly, and to my colleagues as well. So now the decision is why MCPHS? We have the programs, but why would you pick sort of our particular university to study at? One of the things that I can't stress enough is the small class size. None of the SMIT programs have more than 25 students per class, and most average about 10 to 20 students per year. That means individualized attention. We also have the CASE, the Center for Academic Success and Enrichment. The center has professional tutors, academic coaches, and advisors. It also organizes peer tutors for all our courses. We have a writing center and a math center for drop-in hours to help students who are writing papers or study for exams. The radiography, nuclear medicine, sonography, and MRI programs have labs on site now, and the radiation therapy program offers labs at a local clinical site, which is taught by my colleagues in the field. Another good reason, the Longwood medical area. First of all, we're close to a lot of our clinical sites, not all of them, but a few. It is an area where you cannot turn and not find a medical sort of institution or an academic institution. There are very much sought after internships and clinical placements and research opportunities for students. We also offer having a cadre of different medical sort of professions, interprofessional education experience. We allow students to collaborate across the healthcare fields to reinforce today's team-based approach to patient care. I want to thank you so much for joining us in our virtual open house, and please do not hesitate to get in touch with us or our admissions department if you have any questions. Thank you so much.